Welcome once again to Breakfast Central. The health authorities in Uganda have declared an outbreak of Ebola after a case of the Sudan Ebola virus was confirmed in Mubende district in the central part of the country. The Uganda Virus Research Institute confirmed the case after testing a sample taken from a 24-year-old male following an investigation by the National Rapid Response Team of 6 suspicious deaths that have occurred in the district this month.
This is the first time in more than a decade that Uganda is recording an outbreak of Sudan Ebola virus. Now joining us live this morning from Uganda is Dr. Tumusiime Lawrence. He is the Acting District Health Officer, Hoima District, and he'll be joining us to expand on this conversation this morning. Thank you so much for joining us this morning.
I'm glad to be here.
All right, now we know that the 24-year-old man who was reported to have caught the virus and later died was a resident of Ngabano village in the Mubende district, about 247 kilometers from the capital, Kampala. Tell us more about this outbreak and what you know about it.
Thank you very much. Good morning, dear viewers. This is Uganda's fifth outbreak of Ebola. You will remember that we've been having a number of them. The first one came in 2000, and that was the heaviest that we have had. Recording about 224 deaths in that outbreak. The subsequent one was in 2014, and then I had one in 2017, 2018. So the one of 2022 is the fifth. So as you already mentioned, it has started. The epicenter is in Mubende district, and so far that one case has been confirmed. But this morning, we're also getting reports of suspected cases in the neighboring district, like Chegegwa. And so we are up for another outbreak response. I've already told you that we have had 5, and we're looking forward to respond to this one. The ministry has already dispatched national response teams to try and support the local rapid response teams within the district, that's Mubende, and the surrounding districts, which are deemed at a very high risk. Now, where I am, it's about 120 kilometers, and we are in a moderate risk, but we are not seated. We're already getting in touch with the teams on ground. Good enough, we've had a number of outbreaks in the country, and this has helped us to establish a number of structures, the response structures, at different levels, try and respond to incidences like this one.
Well, I also want to ask about, contact tracing. The person who was confirmed dead, has there been any work to try and trace those he may have come in contact with in that whole region?
Yes, the teams are already on the ground. Since yesterday when the case was confirmed, of course I already said there has been a reinforcement from the National Rapid Response Team. So the main aim now is to try and trace all the contacts of these people. This gentleman, a 24-year-old, has, by the time he passed on, had attended 3 health facilities. And so the teams are moving to those areas, moving to the home village to try and get those people whom he was in contact with and try to put them on a list, to have a contact list, and follow them up to ensure that they are helped just in case they develop these signs and symptoms.
You did mention that this is the 5th episode that Uganda is experiencing. We know that Uganda has recorded this number of times, and according to WHO, vaccination has been approved against the Zaire strain, but inoculation against the Sudan strain hasn't been tested. Can you please tell us why it is being delayed from getting tested?
Thank you, pardon?
Did you get the question? Okay, we're saying to you, you did mention that this is the 5th time that Uganda is experiencing the outbreak of Ebola, and we know that WHO has stated that vaccination has been approved against the Zaire strain, but inoculation against Sudan strain hasn't been tested. Can you tell us why the inoculation against Sudan strain is being delayed from getting tested?
Okay, now you realize that we have not been experiencing this kind of strain here. The initial vaccination was targeting the most common strains that we've been having here, the Bundibugyo, the Congo strains that we've been having here. So the Sudan has not been common. I think this is the first time we are getting it in quite a long period of time. And so it was, looking at the public health intervention and then the catering for the most common strains. So this had not been catered for. But now going forward that we have it, I think plans should be underway. Try and have these vaccines also done, and then we see how best to have the vaccination for the most at risk people.
Okay, is there any information as to the level of vaccination, from other strains or for other strains in Uganda at this time?
Yes, so we have had the areas that were very prone to outbreaks, as you can see the trend 2014, 2017, 2018. And so with this vaccination that we had, and the most risk areas, Hoima was one of the districts that benefited. It was not a countrywide exercise. It identified areas that were most at risk. And at least we have had no outbreak in these areas, especially with the strains that were vaccinated against. So we really think the vaccination was success, and so looking forward, benching from that, we could also be able to have the vaccination for the Sudan strain that we had not done before.
How ready would you say that the people of Uganda are to deal with Ebola? We know that the world has been battling a pandemic. Now, in the wake of COVID-19, now you're having to deal with a new strain of Ebola in Uganda. How would you say the health ministry is ready to do this, and how much information is being passed to the people of Uganda?
Well, it is a challenging moment, as you rightly mentioned it. We've still been still in the process of responding to COVID-19 with now the preventive measures like vaccination across the country and so on. But the number of outbreaks we have had in the country, they have not only really helped to strengthen the health system, but also the response team. As I already told you, we have structures at all levels: national level, the regional level, district level, like Rasi and Hoima district. We are already reactivating our district task forces. The sub-county levels will have the task forces. Even at the smallest administrative units, the villages, we have the village task forces. So we are already communicating, giving information to all these members at those various committees that check, there is a problem here, we need to collectively respond this so that we can be able to overcome. So the response strategy and the system is a bit strengthened, and so we think with the good coordination and the experience that we have had, the health workers, the nerves they have got in responding to these previous outbreaks, even the COVID one, which was scary in the beginning, we think we are in position and we can be able to go ahead and respond to this new strain that has come.
All right, Dr. Lawrence, thank you so much for your time this morning. We, of course, wish Uganda the best in this new, fight, and we hope that Ebola is completely wiped out of the conversation. Thanks for your time this morning.
Thank you for having me too.